Hello everybody, welcome to Practical Work Block B5. I am Jarir At Thobari. I will guide you in these practical works of evidence-based medicine or EBM therapy. This practical work aims to help develop necessary skills how to perform critical appraisals and evidence on therapy. What is the critical appraisal? Critical appraisal is the process of carefully and systematically examining research to judge its validity and its value and its relevance in the particular context. In this session, we will perform appraisal, an article with title 3-day versus 5-day treatment with amoxicillin for non-severe pneumonia in young children. This study is a multi-center, randomized controlled trial. This article is available in your guidebook. But before we do appraise this evidence, we must read carefully this article. And to make easier reading this article, we are going to use the Consort checklist, which is also available in your guidebook. Now, we're going to start the Consort checklist.
First, we begin with Consort checklist. Consort, Consolidated Standards of Reporting Trial. The Consort comprises a checklist of essential items that should be included in reports of RCTs. Consort checklist helps us to critically appraise and interpret reports of RCTs. However, Consort was not meant to be used as a quality assessment instrument. Rather, the content of Consort focuses on items related to internal and external validity of trials. Consort consists of 25 checklist items classified into title and abstract, background and objectives, methods, results, discussion, and other information. For this exercise, we use an article titled 3 days versus 5-day treatment with amoxicillin for non-severe pneumonia in young children, a multi-center randomized controlled trial. Please read one by one Consort item and find the item in the article. First, title and abstract. It consists of 1A, identification as randomized trial in the title. 1B, constructed summary of trial design, methods, results, and conclusion. For 1A, for this article, please see the title and abstract. You can see word randomized in the title, a multi-center randomized controlled trial, and also stated in methods from the abstract. So you can check off item 1A. For 1B, please see the abstract. A journal abstract should contain sufficient information about the trial, including trial design, methods, results, and conclusions. It's called a structured abstract. This article reflects a structured abstract, so we can check off item 1B. Move to background and objectives. 2A, scientific background and explanation of rationale. 2B, specific objectives or hypotheses. Now see in the third paragraph on introduction. This paragraph indicates that the author explains scientific background and rationale for this trial. You can check off item 2A. Still in the third paragraph, you will see the objectives and hypotheses on the last 3 sentences from the study background. You can also check off item 2B. For methods trial design. 3A, description of trial design such as parallel, factorial, including allocation ratio. 3B, important changes to methods after trial commencement such as eligibility criteria with reasons. Look at participants and methods in the article. You can see that the researchers clearly describe the trial design. The study did not explain any changes on methods, therefore we assume no changes has been made. Move to methods participants. 4A. Eligibility criteria for participants. 4B. Settings and locations where the data were collected. Still in part participants and methods. We can see inclusion and exclusion criteria as eligibility criteria for participants to include it in the study. You should read carefully these criteria. The settings and location where the data collected clearly explained in the paragraph. Methods intervention. 5. The intervention for each group with sufficient details to allow replication, including how and when they were actually administered. In part intervention, the author explains how the participants were given the intervention. Please read carefully this part to understand what, when, and how the intervention were given. So please check off item 5. Methods outcomes. 6A. Completely define pre-specified primary and secondary outcome measures, including how and when they were assessed. 6B. Any changes to trial outcomes after the trial commenced with reasons. All outcome measures should be identified and completely defined. On part outcome, you can see primary outcome and how they were assessed. Please read this part carefully. Also, any changes outcome definition after the trial commenced is not mentioned. We assumed no changes has been made. You can check off item 6A and no for 6B. Next, methods sample size. 7A. How sample size was determined. 7B. When applicable, explanation of any interim analysis and stopping guidelines. Now look at subtitle Sample Size and Randomization. We can see that the author indicates how the sample size was determined. You will learn how to calculate sample size for a study in the next block. You can check off the item 7A. Any analysis was made before the study completed is called interim analysis to find out if there is safety signal of the study. On the next paragraph, the author explained about interim analysis. Next, methods, randomization, sequence generation. 8A. Methods used to generate the random allocation sequence. 8B. Type of randomization, details of any restriction such as blocking and block size. Still on part, sample size and randomization. You can check no for item 8A. Many types of randomization can be used, such as simple, block, and stratified randomization. In this study, block randomization was used. Methods: randomization, allocation concealment mechanism. 9. Mechanism used to implement the random allocation sequence, such as sequentially numbered containers, describing any steps taken to conceal the sequence until intervention were assigned. The author describes how the random allocation sequence implemented, and also what steps taken until intervention were assigned. Please read carefully this part. So please check off item 9. Next, methods, randomization, implementation. 10. Who generated the random allocation sequence, who enrolled participants, and who assigned participants to intervention. No data tell us who generated random allocation sequence, neither Who assigned participants to intervention? Please check No for item 10. Methods: blinding. 11A. If done, who was blinded after assignment to intervention? For example, participants, care providers, those assessing outcomes, and how. 11B. If relevant, description of similarity of intervention. On the abstract, look at design. It clearly says that the study was double-blind. Double-blind means that both investigators and participants do not know which intervention was given to each subject. Blinding is used to avoid bias during intervention and outcome measurement. And the intervention were similar. You can see from the intervention of which both amoxicillin and placebo were used at the same dose, form, frequency, route of administration, duration, and number of drugs. Methods: statistical method. 12A. Statistical methods used to compare groups for primary and secondary outcomes. 12B. Methods for additional analysis, such as subgroup analysis and adjusted analysis. Please look at statistical analysis. The bar graph describes statistical methods for clinical data analysis and for cost analysis as additional analysis. You will learn more about statistical analysis in the next block, so you can check off item 12. Results: participant flow. 13A. For each group, the numbers of participants who were randomly assigned, received intended treatment, and were analyzed for the primary outcome. 13B. For each group, losses and exclusions after randomization together with reasons. On the page 3, the article displays flow of participants through each stage of randomized trial. Please read carefully this flow. So please tick on item 13. Next, we move into results recruitment. 14A. Dates defining the periods of recruitment and follow-up. 14B. Why the trial ended or was stopped. On page 2, see results. It carries information of recruitment period. No information that the trial is ended or stopped before trial completed. So you can check off item 14A, but no for 14B. Results: baseline data. 15. A table showing baseline demographic and clinical characteristics for each group. Open page 3. You will see the baseline characteristic on table 1. You see that the baseline characteristics are similar between 3 and 5-day treatment. It is also mentioned in the article that there were no substantial differences in the baseline characteristics of the treatment groups. You can make a check for item 15. Results: number analyzed. 16. For each group, number of participants or denominator included in each analysis and whether the analysis was by original assigned groups. Please see table 2. Please compare to flow of participants. In the table, number of participants were analyzed per group in the same number with originally assigned group in flow chart. So you can check off item 16. This is called as intention to treat analysis. It is a type of analysis of clinical trial data in which all patients are included in the analysis based on their original assignment to intervention or control groups. Regardless of whether patients failed to fully participate in the trial for any reason, including whether they actually received their allocated treatment, dropped out of the trial, or crossed over to another group. Results, outcomes and estimation. 17a. For each primary and secondary outcome, result for each group, and the estimated effect size and its precision, such as 95% confidence interval. 17b. For binary outcomes, presentation of both absolute and relative effect size is recommended. Look at Table 2 on page 3. In this table, you see the study result for both primary and secondary outcome. The effect size of outcome on each group presented clearly. The 95% confidence interval was also showed in the table. The outcome was binary. Absolute difference was showed in the table, but no calculation for relative risk. You can calculate by yourself the relative risk we explain to you on the next chapter. So please check off item 17a and 17b. Results. Ancillary analysis. 18. Results of any other analysis performed, including subgroup analysis and adjusted analysis. Distinguishing pre-specified from exploratory. On page 4, look at Table 4. The study performed additional analysis based on characteristics of participants. Results. Harm. 19. All important harms or unintended effects in each group. On page 4, see adverse reactions. The adverse reaction in both treatment was described in this article. You can check off item 19. Discussion. Limitations. 20. Trial limitations, addressing sources of potential bias, imprecision, and if relevant, multiplicity of analysis. On page 4, you can see strengths and limitations of study. Please read carefully in this part. Please make a tick on item 20. Results. Generalisability. 21. Generalisability, external validity, applicability of the trial findings. Generalisability or applicability is the extent of which results of a study can be generalized to other circumstances. For this article, see the conclusion. There is an implication of the study. Then you can make a check for item 21. Results. Interpretation. 22. Interpretation consistent with results, balancing benefits and harms, and considering other relevant evidence. On section discussion, you will see results interpretation in this paragraph. It is also considers other trial in the same topic area. Please read this information on this study. So please tick on item 22. Now, the last part of Consort checklist is other information, registration, protocol, and funding. 23. Registration number and name of trial registry. 24. Where the full trial protocol can be accessed if available. 25. Sources of funding and other support, such as supply of drugs, role of funders. On page 5, the authors report the sources of funding for the trial, competing interest, and ethical approval. No information on trial registration and protocol of the study. For item 25, you can make a tick.